So identifying the communities we serve is really important. And as I said that before, it is really understanding who it is that you want to go out and do outreach to. Who is it that the need is there that is not being addressed? And those are really important. And it's bringing in organizations and listening to what they're saying about who they're servicing and listening to those barriers and all of that, right? So we've talked about that and having these initial meetings about who it is that we're serving. And this really drives us with our partners because we've done it where we've brought in snow pants and snow boots because that was a need. We've brought in blankets, we've done diapers, we've done all those different things because we identify the communities we're serving and the needs specific to them. As I say that, I want you to know, though, that all of our events are open to the public as a whole. It is not just one person or one group that we're focused on, but if people come and we put our information out to the community as a whole, and other people from other communities come in, we're open to everyone. Everyone is welcome. And location selection is really important because early on, safety was really critical, and also co-creating that safe space. So one of the things that we really focused on was making sure that we went where people felt comfortable gathering, that there was accessibility, that there was a trust that has already been built in that venue, in that organization, that we didn't have to go and try to build trust and safety in that venue in order to get people there. So that is where we really focused on, were those types of locations where those communities really frequented, they went there, they felt comfortable, and that we didn't have to create that trust piece, right? It was one less piece that we had to worry about. And then we just had to put together an event that was an experience that would be impactful for them when they arrived. So location selection is really important. As I said before, we've used libraries, we've used schools, we've used marketplace and grocery stores and barbershops. We have stayed away from municipal buildings and government-owned buildings to some extent, other than the schools and stuff like that, because we received feedback from, at least from the groups that we were working with and talking to, about the fears around different events that have happened around those types of locations and stuff. So those are things that we want to share with you that we stayed away from. We went to places that were public places that we knew people would go and they felt comfortable. So we did them in different locations at different times to make sure that we were able to help or able to allow everyone to participate or to come and get their questions answered. Lisa?
Thank you, Dr. Pam. Thank you, everyone, for being here today. Just as an FYI, what we're trying to do in today's presentation, Dr. Pam has already started doing, is if you remember the process that we had laid out, and we don't have enough time to go into great detail about each step of the process or each detail, but we were or are working on a workbook that will provide more detail in many of these areas. So we just pulled together or pulled out some areas that have been challenges for us. I saw selecting a vaccinator partner has been a challenge for some of you. I can tell you personally, this has been the bane of my existence in terms of sleepless nights. So I have learned a lot about selecting a vaccinator partner over the past 14 months that we've been doing this. And just to give you the framework, Dr. Pam talked about for us as a grassroots organization and as the coalition, we have done, I think it's more than 55 events in the last 14 months. And I kind of laughed, Dr. Pam, when you said 2 events in 1 week. I looked at Gina, I'm like, I think we've done more than that. I think we've had 4 events in 10 days, sort of thing. And consistently for me, finding a vaccinator partner has been really a big challenge over the past 14 months. But I'll tell you what I've done and what I've learned is I have numerous vaccinator partners to pull from, because given the resources, the waves that we've had of the coronavirus or the COVID, everything, like I've taken everything into consideration. So we have worked with both private healthcare systems and public health across the board, multiple partners and some additional organizations in terms of vaccinator partners. So I try not to tap one too many times because I know burnout is real. Staffing shortages are real. So when it comes to planning an event, these are some of the things that I'm thinking of. Okay, I used this organization last, I'm not going to tap them for this one. Or I look at the jurisdiction. Where is this event going to be held? I follow protocol there. So I really have a selection process in my head. But the other really, really important thing is we want to work with partners who understand our approach. And our approach is completely different than what has been done in many cases, perhaps from the public health side of things, perhaps from the private health side of things. So we often say this is a community-led event for the community, by the community. This is really, really important. And as you heard Dr. Pam talk about the barriers, we blow through the barriers. So we want to make sure that we have a partner in place who they're willing to meet with us and talk ahead of time about our approach to make sure we're all on the same page. And then I also want to have a sound understanding of their process as a vaccinator. So I know we've talked about in the past, we worked with a vaccinator and they started working with us at an event and they started entering in each person who came in into their EHR. And it was backing people up. We had people waiting in line, people waiting 30, 40 minutes. And we're like, we got to stop that. So again, it goes back to having that trusting relationship at the core. All of the organizers have to trust one another because sometimes we have to have those difficult conversations. So I listed here just some of the questions that are asked in that initial conversation. The second bullet, you'll see, will they allow you to greet people? So in some processes from an organization, they want to be at the front registering people as they come in, and they don't want us anywhere near that. So we had a workaround. We made sure that we had like a greeting table for everyone as they came in, and then we walked them over to registration with the entity that is doing the vaccination. So, and again, a lot of this is not rocket science. It just goes back to that human experience, which if you think about the context, the greater context that we have been in today, many of us have been living in isolation, working like crazy, short staffed. So we're really focused on how do we bring that human connection, that human experience back to what we're doing today for every person that walks in the door. So I have a bullet on here. Does your partner have a friendly and outgoing staff? I can't tell you how many times we've been at events and the vaccinators are not looking people in the eyes. The people at the registration are not looking people in the eyes. Again, it's not finger pointing at anyone. It's just collectively as a community, we have to do better. And then making sure that the teams we're working with, the partners we're working with, are culturally competent. So that means if there's a barrier in place, such as language, that we're addressing that right away, that we have interpreters on site and everybody is comfortable with that. So these are just a few of the things that go through my mind when it comes to us working with vaccination partners. So one of the other things I wanted to address, I know I've seen some questions in the past about like, how do you promote the events that you're doing? How do you make sure that people are in attendance? So you may have heard us say before that when people ask us about how many numbers of people who are coming to our event, we shy away from answering that question. But I will tell you this, we have had events where it's maybe been 5 or fewer people. But in the grand scheme of this, if you look at what we're trying to do, it's building trust. Yes, vaccinations are critically important, and they might be again in the future as things come over, but we want to make sure we're building places of trust. So when it comes to our community outreach, again, we've talked about working with the communities of color, having the right individuals in place to deliver the message. So our community outreach, or if you want to call it promotion of an event, it is not one silver bullet. We are working in multiple ways to make sure that the word gets out. But at the end of the day, we know that that word of mouth is so critically important and who the messenger is. So these are just some of the more tactical things that we do. Yes, we do the old-fashioned in-person canvassing, and we're going to talk a little bit more about that. Yes, we do media. Yes, we have social media. But again, thinking about the barriers that exist for the community members that we're trying to serve. How can we best reach them? And sometimes it does take multiple channels, multiple ways to reach them. Texting has been hugely, hugely impactful for us. And I don't know, Trish, if you wanted to pipe up about texting in our community outreach.
Absolutely. Good afternoon, everyone. And as a community health center partner in this work, we utilize a program called Care Message. And if any of you are familiar with that, it's a program that through our electronic health record, we're able to text out to our patients who have opted in. And I tell you, one of the things that's been so interesting about it is been how we've tailored our language to really reach out to people so they come. At the beginning of our texting, it was COVID-19 vaccination time, date, and location. And that was great because we needed to get the word out. And when you only have about 160 characters in a text that you're able to do, you have to be very specific in the language that you're using. But over the course of time, we decided that that was more informational, important, but because we were creating this human experience, we wanted to make sure we were inviting people to this event. And changing that up, that it was partnerships inviting you, or we're excited to see you on Saturday for vaccination, or just ways that we're able to make people feel like this was not just a spam or a mass text, but something from a trusted provider like the Community Health Center saying, we'd really love to see you. We were at an event one time and we always ask people, how did you hear about us? And it's a little bit of everything. And many people say, well, I got the text, or someone told me I had to go. And one gentleman came up to me and said, I was invited to this. You guys invited me. Didn't you remember you sent me the text? And when we think that community engagement requires an invitation, and many times our patients and communities, particularly those most marginalized, don't get invited a lot of places. And this was an opportunity for us to really engage and say, welcome. We really want to see you. You are important. Not scoop you up with a net and bring you here because you better get that vaccine, but how can we engage with you and connect? So texting has been a really low cost and really wonderful way to connect with the community.
But like you said, Trish, the wording and how you do it, it's connecting it right back to that human experience, and you are valued. And going back to our outreach, and I want to specifically talk about rural outreach. So recently, Ernesto and I hit the road in rural Calumet County, and we're going to continue to do more and more of this. So literally going door to door with the flyers in hand, with information about health insurance and partnership in hand. So having those conversations firsthand, on the ground, door to door, visiting mega farms, going to mobile home parks, you name it. We had a map specifically planned out, identified ahead of time where we needed to be. And then this is key. Like, we're not just there to drop off materials. We are there to engage. Again, you know, it's an opportunity for me. I was trying out my Spanish and able to have a few conversations, but again, like just engaging with people through this process, putting the heart back in everything we do. One thing I want to make sure that I consider this our secret sauce, and I often say this to Trish, is literally when we have events, we are out there canvassing while the event is taking place. So Trish, I will look to you and to share some of your magic.
Well, you know, and we always look at it that the event isn't from 2 to 5, but the event is an ongoing relationship building, whether it's right now or for future things. And our team is really energized when it comes to the day of, because we know people are coming in, but we also know there are people out there who didn't get our message. And how do we rock the block, walk around, meet with people? Here we are at an African-American barber shop, but next door is a Mexican market. Let's walk in and order a taco, talk to the manager, see if their kitchen staff would be available to come over. And again, not a, hey, come on over, it's here, but wow, we're here. Would you guys be interested? What questions do you have? How do we do that? Walking by a bunch of roofers on lunch break. guess what, guys? We're having a taco truck. If you need to get vaccinated, it will keep you healthy for the roofing season. Come on in. There's never an opportunity, and some of my favorite have been, and Lisa, I don't know if I shared with you this last time, a couple of strip clubs. You know, they don't really kick in until around 5, 6 in the afternoon. A little bit before that, the Purple Hippo in Oshkosh, there we were knocking on the door saying, ladies, are you interested in staying healthy? But it gave us more than just the COVID angle. It also gave us an opportunity to talk about total health care. Never limit your opportunities for engagement by we should only go to these places. Sometimes it's a quick stop at the gas station on your way to the event to engage. We got a number of people who were on a motorcycle tour over to an event and got vaccinated because we were all getting gas at the same time. It's that convenience, but it's also that opportunity to be like, hey, we're human. Here's an opportunity, no barriers. Let's make it happen. So no time like the present to meet and mingle, but also it's a great way to connect and also hear. And I think from the poll at the beginning, the mistrust and the misinformation, to even have that introductory conversation with people who are hesitant and who might not be like, okay, sure, I'll go and do it today. A lot of times we hear the reasons why they can't. And by hearing why people are not ready to go get vaccinated helps us also drive our strategies for the future.
And I just wanted to say, Trish, that's wonderful. I want to just chime in a little bit about that piece of outreach and canvassing is so critical. And our preparation for that is to make sure we have medical professionals that are there. So we have tapped, and I know if Lisa and Trish will talk about this later as well too, but we have tapped retired doctors, physicians to come. And so to Trish's point, when they come in, they may not just want to talk about vaccination, but maybe other pieces of health, right? And so we have the medical healthcare professionals there that can address those different pieces as well too. So, you know, when you do these pieces, we try to think broader and bigger than just the vaccination piece itself, but overall wellness and well-being, and making sure that we have the resources on site when they come in to be able to help them head in the right direction, or to give them additional information, or to do follow-up with them.